so preparing for pregnancy in early stages. And a lot of people hate this word, and I think they're also afraid of it. Do you guys know what the word is? Preeclampsia.
Oh, okay. Yeah.
And look at your faces when I said that. So I just want to have you guys explain what preeclampsia is, and also maybe give some pointers that will help people to understand how to maybe navigate from obtaining, I don't even know if that's the right way, but obtaining this disease.
Okay. Well, so preeclampsia is pregnancy-related high blood pressure. So it's like a sudden spike in the blood pressure. And if you start showing signs and symptoms while you're pregnant, you let your doctor know, or when you do your visits and your doctor, sees like, you have swelling in your feet or sees your blood pressure is not in the right parameters, they will, test you. They can do a blood test, to see if you have tests like to see if you may be at risk for it. And especially a lot of young women, they do suffer from preeclampsia, and there are a lot of women that may not have a preeclampsia while they're pregnant, but when they're in labor, then they can, yes, develop preeclampsia, and that's an emergency, and that could require, a cesarean section. Symptom, monitoring the blood pressure, of course, eating the right foods, avoiding like sodium, but, also being mindful and looking at yourself, looking at your body and looking at the changes. If you notice swelling, if you notice you're getting headaches, blurred vision, is feeling dizzy, report these symptoms to your, doctor when you go to your, appointments. And so they can make sure to, do testing if necessary.
And this is something that's really, really common in the Black and brown communities, which is why I definitely wanted to bring it up.
Yeah.
Because people are afraid of it. And I naturally think that they just do not understand it. And when it's brought to our attention, it's just like, oh, red flags. Everybody just be scared, but it's not the end all be all in my purview.
Yeah, it's not the end all be all. I mean, unfortunately, yeah, it is. There's a high occurrence in the Black and brown community. Women, when they're pregnant and in labor. I think Beyonce shared that she had preeclampsia, and that's why she had to have an emergency C-section when she was delivering her twins. And again, I don't want to jump into it, but, we're sharing, when we're telling them, oh, I don't feel too good. And they're saying, oh, that's normal, and we feel dismissed, and we feel like the Black and brown women, we feel like, they don't believe us when we're telling them that we're in pain or we're having these symptoms, and it goes unreported, like it's not bumped up to the next person. Like if a shift is changed, it's not reported or it's not addressed. And sometimes, the time it should have been addressed, then, it gets, it's too late, and there's, just unfavorable outcomes with that.
So a couple of things. So as you said, Black women are at a higher risk for preeclampsia, hypertension, right? I have some mentors, some midwives that I know that because they have Black pregnant people and they service Black people, they check your high blood pressure often. They check it more often than they would their white patients or their white clients. So you want to make sure you have a provider that is keen to you being Black and understand what is going on in our community. Because I remember way back, not even way back then, like I remember being a kid and people coming to our church to teach the older people to check their blood pressure and things like that. And that's exactly what needs to happen with pregnancy now. Like you have to have a blood pressure cuff. You have to check your blood pressure often. If you find yourself having headaches, let your doctor know. They'll come in and check to see. The thing about preeclampsia too, it could either happen during your pregnancy and then they have to monitor you closely, or like it could happen really fast during labor. And I'm not a clinical professional, but like some things that they do, they check your